All right, well, thank you all. Welcome to this Partners in Care Foundation sponsored community forum to help us all learn from some key experts. I will note the session is being recorded, so if you're uncomfortable with that, we just want to make it your choice. So, good afternoon. And on behalf of Partners in Care Foundation, it's really my pleasure to welcome you. This is the first in a new series of virtual presentations to the community we're beginning. An urgent COVID update, how to get the vaccine for you and your loved ones, a central question for so many. And just to introduce myself, I'm June Simmons, and I'm the founding CEO of Partners in Care Foundation. So over the past 23 years, I've had the distinct pleasure of leading our impactful organization. We pioneered the development, scaling of evidence-based innovative interventions for management of medication at home, for self-management, chronic health conditions, and coordination of care to improve health outcomes are a real priority. We're a change agent that also provides services to inform our change agent work, working with the mission purpose of integrating social and healthcare so that the whole person and how they live is really critical to success and helping people succeed in living in a community setting of their choosing and mastering the opportunities of aging well and the challenges of dealing with short or longer term health injuries or disabling conditions. So today in our presentation and in the series to follow, we're trying to highlight many of the challenges that we address in our ongoing mission-driven work that is really, we're not that big, so this is a lofty goal. We want to help shape the evolving health system by developing and by spreading high-value new models of evidence-based, community-based care and self-management for the wonderfully diverse populations with chronic conditions that we have in our region. So as the COVID-19 pandemic has gripped Southern California, which it has, and the nation, it has obviously required for all of us a new way of living, staying healthy if we can, protecting ourselves and our loved ones, changing the way we work, changing everything really. And so every day at Partners, our staff and I are called upon to address that. It's changed how we work as well. We have people that we care for who are living at home. We help them do that. So isolation is a question. The vaccine is a critical question, and we're working hard on it. I'm sure you are too. So questions weighing on the minds of so many. What are the vaccines? How do I get one? Are they safe? Are they effective? So today we're really pleased that we've been able to bring you, with the help of Laura Trejo, I might add, two outstanding experts that I'll introduce in just a moment. So we hope by the end of today's presentation, we'll have been able to answer the questions that are weighing on the minds of so many of us joining in our audience and across LA. And then this information that is shared this afternoon is provided for the education of the community, and nothing that's said here today is intended, however, to be a substitute for the advice of your physician, your medical provider. So please, of course, talk to them. We always encourage talking with them about your own unique medical needs. And this recorded session, of course, it's being recorded so it can be available on YouTube. And you can access that through the Partners in Care Foundation website. So now, without further ado, it's really my pleasure to introduce you to Dr. Pinting, or Karen, Nie, and Dr. Chandana Das, both of whom work with the COVID response team in Acute Communicable Disease Control Program. It's a healthcare outreach unit of LA County Department of Public Health, who's working valiantly to lead us all through these trying times. So these two fine physicians are directly involved with the COVID vaccine efforts for the county, especially focusing on vaccine rollout to older adults, 65 years and older. Dr. Nie is board certified in internal medicine and geriatric medicine, both, and they both have infectious disease specialization. Dr. Nie graduated from the University of Maryland School of Medicine and completed her internal medicine residency right here at Olive View-UCLA in LA, and then completed her geriatric medicine training at the VA-UCLA Geriatric Fellowship program. She has clinical experience caring for vulnerable, underserved older adults as a provider in PACE, the program of all-inclusive care for the elderly in Chinatown. So she knows what she's doing. And Dr. Das as well, expert, trained in internal medicine and geriatric medicine, graduated from St. George's University School of Medicine, completed internal medicine residency at State University of New York, downstate in Brooklyn, and completed geriatric medicine training at VA-UCLA Geriatric Fellowship program. As you listen to them, we ask that you enter your questions into the Q&A box at the bottom of your screen, and we'll try to get to all of them after both speakers have made their presentations. And also, if you know of anyone who might like to be added to our guest list for future presentations, please add their emails to the Q&A box at any time. And now, it's my pleasure to turn things over to Dr. Nie. Thank you, Dr. Nie and Dr. Das, for joining us today. Look forward to hearing you. I think you're on mute. Oh, there you go.
Thank you. Thank you, June, for that wonderful introduction. And I just in case anybody looks this up, I'm not, I don't have formal ID specialization. So just geriatric internal medicine trained, but some disclosures. There is no commercial support for today's presentation. We don't have any financial interests related to the content that we're presenting. And this session is meant for 65 plus population and related community stakeholders, and it's off the record. So if there's any reporters, please log off now. Next slide, please. This is always a disclaimer that we have for anything related to the COVID pandemic, and this is as true for the vaccine as well. This is a rapidly evolving situation, so the information being presented here is current as of today, March 4th. And we highly recommend for you guys to continue checking our LA County Public Health website, the CDC, and also and to utilize the resources that we will post up at the end of this presentation. Next slide, please. So when we started, just to back up a little bit, I know that there is a variety of audience members. Some of you might be older adults, 65 plus, looking to get vaccinated. Some of you might be family members or in community-based organizations wondering how you can get your clients vaccinated. So, you know, we want to allow enough time at the end for there to be questions, because I don't think we have all the diverse content to address everyone. But just wanted to put this in context and inform how we've been approaching vaccination outreach for 65 plus in LA County. So when we first started this work, you know, we thinking about it from a geriatrician's perspective, we know that 65 plus are going to have a hard time reaching these traditional vaccination sites like the megapods that we all know so well. And as well as not just the megapods, but also just a normal vaccination site at a clinic or a hospital, due to a variety of barriers. And so these barriers I have listed here in the bubble on the left with labeled as gaps: difficulty with technology. Even if someone has a smartphone or a computer, they might not be comfortable, or might not be easy to navigate the website. And then you have to refresh it. You have to really be on top of it to find that appointment. So that's, the digital divide is definitely a gap. Also, once you have the appointment, how do you get there? So that's definitely been a barrier as well. And also lack of vaccine confidence, or having a lot of vaccine hesitancy. That kind of varies community to community, either geographically or by race, ethnic groups. So that's been a barrier as well. Language, if someone just doesn't speak the language of, if they're not being offered vaccine information in their preferred language, that can be a barrier. If they're undocumented. In addition to all of these other barriers, just the fear that they would somehow get reported, especially since public health is seen as another government entity, if they're uninsured, underinsured, and also, of course, if they're homebound / bedridden. So that even if they had transportation, it would be difficult for them to get to get vaccinated. So,
Ye, can you turn on your camera by any chance? We'd love to see you.
Oh, okay, all right. Can you see?
Beautiful.
Okay, great. Sorry, I have this on 2 screens. Okay, great. So where was I? So I've put in blue. I've put in blue and italicized the top 2 because we feel like, just from the talking with a variety of stakeholders and just interactions with a community, these have been the top 2 themes. And so we're working hard to address those with our call center that we've increased the capacity for, as well as making more appointments that are just available for people who call in, and kind of setting aside reserving those appointments for people who call in, so that they don't have to compete with those people who are making appointments online. And so on the right, we have here, a bunch of community resources: senior housing organizations, senior centers, home delivered meal programs, ride shares like Uber and Lyft. I didn't put it on here, but also just your usual paratransit like Access, other transportation options. The medical community, hospitals, pharmacies, clinics, FQHCs, health plans, mobile vaccination groups like CARE, Ambulance, and Curative, that I'll talk about a little bit very soon. The city fire departments, and of course our AAAs in the for LA County, LA City Department of Aging, and WEDAC, and so many more nonprofits, alliances that we're talking to. So there's a lot of resources and people willing to help. And so DPH, what we see our role is not just the vaccine allocation, deciding how many doses to go where and to whom and to which communities, but also, we ourselves are a vaccination provider with the megapods that I talked about, and also some smaller pods. Sorry, pod stands for point of dispensing. And so basically these places where we are distributing and administering the vaccine. But our third role, and we see this just as important, if not more important, as being able to coordinate and connect resources with these gaps. And one place that we have really focused on, and it's just in the last week and a half, has really hit the ground and running, is our mobile vaccination effort. So I'll talk about that a little bit more now. Next slide, please. Oh, I forgot that I had this slide, sorry. So, but this does relate to our mobile vaccination effort. So, nationwide and especially LA County, we've had a limited vaccine supply. And because of the limited vaccine supply, that's actually heightened the need to make sure that our vaccine allocation and outreach is as equitable as possible. And so to put this in context, I wanted to share these two maps here. The one on the left are the COVID adjusted death rate per 100,000, and the lines are by city and community. And so the darker the blue is, that's where that's where the higher death rates are. And so you'll see that it's concentrated in your South, Central, and East LA regions, as well as in some parts of East LA County, like Pomona, La Puente, El Monte, South El Monte areas, and then also your San Fernando Valley, and then going up to your Palmdale, Lancaster area as well in Antelope Valley. And not surprisingly, the map on the right, you'll see that it pretty much mirrors with the communities that have that perform poorly on the equity index, which is the Healthy Places Index. And I think that makes sense because these communities where they're more socially vulnerable, they have more working class residents who still have to work and might have more comorbidities, don't have as great primary care or health care, or just access to health in general. And so they're getting COVID at higher rates and also dying of COVID at higher rates. And so these are the areas where we are concentrating our efforts, where we are prioritizing our vaccine efforts. And it's also because I didn't put this map up, but there's another map on our website, and these are all publicly available. We also have a map that shows the vaccine coverage percentage throughout LA County, and unfortunately, the areas that are lagging in vaccine coverage are the same areas that are hardest hit. So, just now we have a vaccine gap as well. And so that's, why we're working so hard to prioritize these areas, including for 65 plus. Next slide, please. So this is to show our how our mobile vaccination effort has, how it works. So, I'll start actually with our CBOs, because this is really, an important collaborator. And when I say CBOs, it's actually quite a loose term. It could be a nonprofit foundation. There's some like trade association type of organizations that have access to lists of senior housing, senior centers. There's obviously also the AAA's, WEDAC, and LA Department of Aging that have a wonderful list of senior centers. So we work with them to get these kind of facility line lists, and they also help us out to outreach to these centers and senior housing properties to let them know that this is what we're doing, and to reassure them, and to give any additional support, like if there's service coordinators that are available. And then once we have those lists, we have a team that calls out to these facilities and assesses their interest, tells them about this project, and also introduces our third-party vaccination teams or vendors, which are Curative and Care Ambulance. And then once they agree to this outreach, curative and care ambulance then takes over to schedule an appointment for the first and second dose, if we're talking about the Pfizer and Moderna vaccines. And they pretty much manage end-to-end vaccine administration from the registration and all the state mandated reporting systems, and also data reporting to things like care. And then they go out to the senior housing and senior centers. And so in terms of the responsibilities of these sites, they just obviously need to be able to host a physical place. That could be a parking lot, or if it's indoors, a large communal area, like some places have held it in their activities room, for example. And then the facility point of contact just needs to help arrange outreach, pre-registration, day of on-site coordination, and if it's a senior center, then also transportation. We do have some community partners like city fire departments, LA City, LA Fire is a big one. Also Chinatown Services, which is an FQHC, and Alignment, which is also, sorry, not an FQHC, but a Medicare Advantage plan that has their own clinic, that have, and all of these entities, they are also helping us to do mobile vaccination efforts at senior housing sites that are within their jurisdiction or that they have a relationship with. So it's definitely very much a collaborative effort. And it's great that we're able to, bring the vaccine to these seniors at the places where they're living to try to overcome and address the barriers that we talked about before. Next slide, please. Sorry, and actually, I'll talk about this, but I was thinking I wanted to say one more thing about the mobile vaccination efforts, which is we are initially focusing on going out to senior housing and senior centers that are within the communities of hardest hit by the pandemic, or have, lower vaccination coverage rates. And so that's related to those maps that I brought up earlier. And then once we hit all those areas, then we will go back to the rest of the county, but we really wanted to focus on those high needs areas. And so just a little bit information about how to get the appointments. This is our website. The short URL is vaccinatelacounty.com, and the URL, the Spanish URL version, is the one below that, and it does take you to the Spanish version of the website. So that's great. But I also, so when this is a screenshot of the landing page. If you click on book an appointment, that will take you to the next page that I'll show soon. And so, but there's a lot more information on this page, like if you have questions, there's fact sheets, etc. So feel free to explore that. But there's something I wanted to point out, which is this phone number, the 833 number. Residents with disabilities or without computer access can call between 8 a.m. and 8:30 p.m. 7 days a week for assistance with appointments. This was the call center that I was talking about, where we heard from the community that it was hard to get through, and the wait time was a long time, but we've since increased that capacity and also have, like I said, set aside appointments to be made just for those people who call in, so that they're not competing with those people online. Next slide, please. So this is, once you click on the book appointment page, it'll take you to this page, which we actually revamped just, I think, earlier this week, very recently, make it hopefully simpler and easier to read. So, you know, it helps you go through all the steps to see if you're actually eligible. And now that we have Johnson & Johnson coming out, checking the type of vaccine that you need. For example, if you got a first dose of Moderna, then you'll need to have the second dose that's also Moderna. And then the third one, I think people will be clicking on the most, which is looking for an appointment. That helps you to find which clinic or pharmacy that you can go to for your appointment. And further down, there's also a lot of information about what kind of documentation will be required. And it's not, for 65 plus, there's a lot of documentation that you can show. And they're all examples, so don't feel like if you have something that has you know, your photo, name, and date of birth, but it's not specifically listed, don't panic. Just bring whatever you have, and then, you know, I feel like as long as if you it has those three things that I mentioned, your full name, date of birth, a photo, then it should be fine. But you can look at that list to just see, to give you ideas of, you know, the examples of things that we're looking for. And so that's proof of age, but also proof of residency in LA County. Because we do get a lot of people who are coming from nearby counties trying to get appointments here. So yeah, and this is the direct link for this page in English and in Spanish. But again, you can just get here from clicking on that button, the book appointment, from that main landing page. Next slide, please. And then here are some additional call lines to actually make vaccine, to get help with making vaccine appointments that have more language support, because the public health call center line that I just spoke about, it's available in English and Spanish, but those are the only two languages that I know of so far. So there's the 211, and there's also this other language support from the National Asian Pacific Center on Aging, and they have language support in a variety of Asian languages as well as Spanish, but here you see Japanese, Cantonese, Tagalog, Mandarin, Vietnamese, Korean. And again, both of these call lines, they help you to make the appointments if you're over 65 and or just have difficulty with the online appointment system. But they do not have something like that's noted here from the 211 website, is they don't have additional appointments. So if you can, and this is not so much for our 65 plus who really need this service, but for the general public, to not call them if they can actually visit the website and do just fine there. Next slide, please. So we heard from June and Partners in Care that there was an interest in learning about how to overcome vaccine hesitancy or build vaccine confidence. So I wanted to turn that over to Dr. Das to speak more about that.
Hello, everyone. Thank you for joining us today. I guess I should start also with the same disclaimer that Dr. Nie did, that I am not an infectious disease doctor either. We are both geriatricians. And I also apologize.
Can you go on camera?
Yes, I was about to say I apologize, but I will not be going on camera because
Oh, I'm sorry. Okay. I will enjoy you anyway.
You know, working from home, I prioritize comfort over presentable clothing, so I'm not dressed for a presentation. But yes, you can just, my part is short anyway. So what you see on the screen here is, as we mentioned in our introductions, Dr. Nie and I are normally in charge of the infection prevention and care of nursing homes and non-nursing home congregate caregiving facilities for the elderly. So what you see here is a snapshot of a document that we have on our website, which is germane to our non-nursing homes and provides tips for facilities to increase vaccine acceptance in the facilities and vaccine confidence. So here you see high impact best practices. The reason we're sharing this with you today is that these are ways for, although they are ways for facilities to be increasing vaccine confidence, they are also ways that as a long-term care case manager, or even as a family member of someone who is eligible for a vaccine but may have some concerns, these are some ways to address those concerns and to hopefully increase the person's confidence in the vaccine. As you know, we are very confident in the vaccines. We were, first in line and we were ready to go. So we really believe in these things. Major strategies for policies and procedures. There are ways for staff to not to be given time off, and establishing a formal space for the vaccines so that it's a set place and it's kind of special. In terms of talking to people about vaccines, the vaccine confidence registration storage may not be very relevant to you, but having people who have gotten the vaccine already to speak about their experience with your loved one, having a celebratory atmosphere around the vaccine, and providing just an ear to hear what the person's concerns are before trying to over-educate them. A lot of people don't want to be educated. They just want to air their concerns and know that somebody is listening to them. And engaging in one-on-one talks for that kind of thing. Next, please. So this is a continuation of that document. It's a one-page document, and we couldn't fit it all on one slide. But listen to understand, not to respond. And don't be judgmental. Engage in multiple conversations. Sometimes a lot of people are just on the fence. They may at first say they don't want to do it, but really they're waiting for more information, or they're waiting to see how it affects others, or they just want to be assured that it's safe. There's a lot of different reasons. Some people have personal beliefs, but these are colored by different experiences that they may have had, and just talking about it is a good way to increase their confidence. Here, we have promote positive testimonials, including from facility leadership, respected staff, other residents. If we're talking about you speaking with a loved one, maybe their doctor is a good source of information for them. You can go online to trusted resources, not Twitter or Facebook, but the CDC's websites, the California Department of Public Health's website, and of course our LA County Department of Public Health to find information about the vaccines. We also have a phone line that people can call to ask questions, and I believe that's coming up in a later slide. And again, making a celebratory atmosphere. If it's a matter of, how we kind of reward our children for getting their vaccines when they're small with sweets and lollipops, take your loved one out for a nice meal probably to get for takeaway and bring home and eat. But something that's nice for the person, or maybe like a walk in the park or something afterwards, just as a nice thing to do on the vaccine day. And then providing written materials. Again, if you go to trusted websites, you will find these kinds of things. A lot of places that are giving vaccines are taking these tips. So they are providing things like stickers and buttons saying that they're vaccinated, and just like how we get the stickers after we've voted. And I'm sure that if you go to any of these places where people are being vaccinated, these staff will give you testimonials on why they were vaccinated. And then that's also another reason, another thing that helps, I think, increase vaccine confidence is thinking about why we're getting vaccinated. You know, we're trying to get vaccinated to decrease the transmission of COVID-19. We want life to get back to normal. We want to be able to see our loved ones again. And you know, that's part of the reason for many people. Next, please. So this is just a little bit on the Johnson & Johnson vaccine. We know that there are a lot of things flying around in the media about it, and we just want to assure everyone that it is safe and it is effective. If someone or something or some news outlet is reporting comparing the Johnson & Johnson vaccine to the other two, the Pfizer and the Moderna vaccines, it's not a fair comparison. They are different types of vaccines. They work in different ways. The Pfizer and the Moderna vaccines are mRNA vaccines, and the Johnson & Johnson vaccine is an adenovirus vector vaccine. The studies have shown that the Johnson & Johnson vaccine is 100% protective against death from coronavirus. It is 93% protective against being hospitalized when you've caught the coronavirus, and it is almost 85% protective against severe disease from the coronavirus. It is also 66% protective against symptomatic disease, including mild disease. So the thing that we care most about are disease that is severe enough to hospitalize you or to kill you. And as I just said, the percentage of Johnson & Johnson protecting you from these things is very high, just as the Pfizer and Moderna ones are as well. So from the public health and from the CDC perspective, the Johnson & Johnson vaccine is just as good as the two existing mRNA vaccines. One pro is that it is only one shot, and it is much better tolerated than the mRNA vaccines. Anyone who has had some intolerable side effects from the mRNA vaccines from the first dose, you can consider getting the Johnson & Johnson vaccine more than 28 days afterwards. So that may, be something to consider because it is much better tolerated. And then in terms of our elderly over 65 years, this vaccine has been shown to have a good safety profile across multiple continents for the elderly over 65, and even for people with HIV and for people with various other chronic diseases. It's safe. And the virus vector cannot replicate in the human body, which is why it's being used in this vaccine, and is also a safety mechanism. Next, please. Next slide, please. Thank you. So this is basically our last slide. This is our online resources. Again, for booking appointments, we have our English and Spanish links right there. There's the document that I showed for the non-SNF congregate caregiving facilities link is right there, the COVID-19 vaccine acceptance one-page tips. And the third link you see there is our vaccine provider information hub, and that's just more for facilities or agencies that are providing the vaccine. Then we have some links here from the CDC, their maiden vaccine page, Vaccinate with Confidence, which is on vaccine confidence, recipient education, which is education on the vaccines for anyone who is on the fence or wants to read more about it. And then another page that is just on the mRNA vaccines, which are the Moderna and Pfizer vaccines, as well as a page that is just about the viral vector vaccine, which is the Johnson & Johnson, or another name for it is the Jansen vaccine. And then we have a website, Stop COVID-19 California, which is specifically from California in English and in Spanish. Next, please. Okay, so that's basically it. We don't have much more to say there, so now we can take your questions.
I also just wanted to point out, if you can go back one slide, the Stop COVID-19 CA California website, that one, those resources that we've listed there in Spanish and English, those are FAQs that were developed by a coalition, including UCLA, their like equity center, where they helped to conduct, I think it was like 13 focus groups on a variety of race ethnic groups to understand what their concerns were regarding the vaccine. And so these two fact sheets are, they came out of those focus groups to be more culturally appropriate.
Well, this is excellent, and we look forward to some dialogue with each of you now. We really appreciate you taking the time and bringing this to brief us. As we all know, this is an unfolding scene. We've seen dramatic expansion in the availability of vaccine federally in the last 6 weeks, and we believe that will be trickling down and hopefully rushing down to us with the presidential prediction yesterday that all Americans could have been vaccinated by the end of May, which would be fantastic. We don't know what the variants will bring, of course. We don't know what it'll mean that some states are opening up. It seems a little early. We appreciate the leadership we have in this county and in this state. And of course, we see these frightening disparities across populations here in our own region. So I think you highlighting the rich diversity we have, and that we have to be skilled in working with that to really make this fully accessible across cultures and languages and concerns that people have. And so we appreciate that. I know at Partners in Care, we serve highly diverse populations. Many of them are in home and really cannot easily transport to a setting and aren't in a congregate setting. So as we've shared with you, we're really eager and beginning to work at and find resources for in-home vaccination. I'm assuming that the Johnson & Johnson will be a preferred arrangement for that, just for efficiency. But we're excited about your leadership. We have some questions from the audience, and if you don't mind me naming you, Laura Medina, who we're very pleased to have with us, is asking what your outreach strategy is for seniors living in hard-hit communities who do not reside in senior housing buildings or who have do not have senior center connections. So a very good question. Can you respond to that?
Yeah. So a lot of the senior centers that we've reached out to, I would say like the majority of them are actually owned by the city themselves. So they are not limiting their outreach to the ones that are specifically served by the center, but are expanding their outreach to everyone that's 65 plus in their city. So that's one way, but I think the other way is, sorry, hold on. What's your outreach to seniors living in, who do not have those connections? So the other, there's just so many things to talk about for 65 plus vaccinations, but I mentioned briefly that one of the resources we have is the existing medical community. And so we continue to engage them to help vaccinate in their local areas. And a lot of them have, responded to that. Like actually June can talk about, her being able to connect some of her seniors with like MLK and Northridge Hospital, I think it was. So yeah, so that's an example. We know that, you know, FQHCs, they've been very proactive about reaching out to eligible populations, especially seniors. We're also, different parts of our department are working with consulates to not just help make that connection of the people who need the vaccines to vaccination clinics in their area, but also to help them address vaccine confidence. So there's those efforts. And then, like I said, for the call center, we do have appointments that we are, you know, that are only available through the call center for seniors. And those can be, it's not just to the megapods. I think actually we're moving away from making appointments through the call center. We're moving away from having those appointments take place at the megapods and actually take place more often at local pharmacies, FQHCs, and the like.
Yes, you were mentioning some of what we've been doing. We're fortunate to reach out to some specific providers. Northridge Medical Center has a family medical care center that's quite lovely, and we were able to take a block of appointments and call out to our the people that we're helping who are frail or disabling conditions, 65 and over, and make appointments and arrange transportation so that they would not be trapped in a car or standing in line or in a crowd, and to be able to bring them in by appointment. And they've also indicated they might work with us, with some of their residents might be able to make home visits. And we're thinking, I don't know, one of the questions is, when will the Johnson & Johnson vaccine be available? And we're interested because we would like to see, then, would there be a way to coordinate for programs like ours, or many programs like ours, where we would be able to somehow access that and arrange vaccinators, qualified vaccinators, to go to the home, one shot, one trip, much more efficient. What are your thoughts?
Yeah, no, we also encourage that strategy as well. And we know that there's been concerns in the media about how it's a lesser vaccine, and that it would be given to people who are, but you know, we don't think that is. And so we want to encourage the use of that for, you know, populations where it would be hard to have those 2 visits. So, you know, we support that. And in terms of when it's coming, so I believe we do have an allocation coming to LA County either next week or the week after, but we don't have any idea after that. We had been hoping that it would be a steady distribution, but I think it seems like, at least for the beginning, it will be, we don't have like we don't have a forecast that's further out than just a week at a time, unfortunately.
Hard to plan, but so organizations can reach out to you to try to see if there's a way to access that, if they can arrange vaccinators for home, it sounds like.
Yeah, I guess it's not a steady allocation that we're receiving. I think we might be hitting like a couple weeks of a dry spot in terms of getting Johnson & Johnson after the initial week of allocation. Yeah.
Well, there are no miracles, I guess. We're thrilled at the expansion and the creative leadership. Yeah, that was, I think, Kitty Sippy's question. There was another question from Kitty, which is, can we have these slides emailed out, or will it be available on a county website? Can you answer that?
Yeah, I think it can be, I guess we'll let you know if it can be emailed out, or if we can post it on our website. But I think you guys are also recording this anyway. At the very least, we'll have that resource slide sheet emailed out to for June to distribute.
Great. If you'll let us know what we can send, we have emails from registration. We'd be glad to share any materials you can make available, and then it will be available. I'll notify how to access on media. We had another question from Angie Chow Osako about being able to, can I still get the COVID-19 virus after being vaccinated, is one question.
So before, there's good evidence coming out that, I'm not so sure about the Johnson & Johnson one, but for the Moderna and Pfizer vaccine, there's good evidence coming out that it also is very effective at reducing transmission. So basically, if you can get the vaccine in the first place, because initially when these two vaccines first became available, all we knew evidence-based wise was that it was protective against symptomatic disease. And so we didn't actually know about asymptomatic, meaning that if you got the virus but just didn't show symptoms. But like I said, there is good evidence coming out that that also is highly protective. The asymptomatic infections and just so preventing transmission in general.
Yeah, and you can see the sequel question she has, since COVID-19 is evolving, do we need to get vaccinated every year because the virus keeps changing?
Oh, yeah, that's a great question. That's a very commonly asked question. We don't, it does seem like a booster shot, as it's called, will be needed at some point, but we don't know what interval that's going to be recommended at. And yeah, we don't have much more information about that at this point.
I was wondering if Laura Trejo is still on the call. If Laura, you might want to unmute yourself and talk, because there was a question about the senior centers and who they can serve and how they're outreaching. If the senior centers themselves, if you are leading some strategies there for neighborhood services and other arrangements. Are you with us and able to unmute and speak? See if I can find you. I don't know how to do that.
June, there's a couple of questions in the chat box as well. One of them is, how many days after getting the Johnson & Johnson vaccine will people be protected against COVID-19?
Yeah, so I think I didn't have a chance to check the CDC website again, but I think the official CDC guidance is still, we're still waiting for that to come out. But it's looking like the guidance will be, we would consider you fully protected not until 20 days after.
And which vaccine is the best for someone with penicillin allergies?
Oh yeah, that's a great question. For allergies, I think, you know what, actually, I'm not sure about allergies. I think the side effects that they looked at that, made it, when we say that the Johnson & Johnson was better tolerated, it was looking at like those more systemic symptoms of myalgias and fatigue. So I'm not sure about allergies. I don't want to make a recommendation. Chandana?
Yeah, I'm actually looking at
Dr. Duss.
Sorry?
Duss?
Yes, can you hear me?
Did you want to speak? Yeah, go ahead.
I'm actually looking at the CDC website right now, and for the mRNA vaccines, what we always say is that even if you are allergic to penicillin, If it is not a severe allergy, which requires epinephrine, you can still get it, the vaccine. And then, you know, after you get the vaccine, we have an observation unit where we watch everybody for 15 minutes. We watch you for 30 minutes if you've had allergic reactions to penicillin before, just to make sure that you do not get something right after, because usually if you get an allergic reaction, it's within the first half an hour.
Yeah.
Let's see.
But yeah, I think between the mRNA and the Johnson & Johnson vaccine, I don't know if there is that recommendation for which one is better for allergies specifically.
Right. It doesn't say anything specific to penicillin allergies. It does say that in the Johnson & Johnson vaccine, there are no eggs, preservatives, or latex. So that's nice. And each of the vaccines has a full list of ingredients, fact sheets. So before you get it, you can check out if you're allergic to any of the things in it.
Does the Jansen affect your DNA at all?
No, none of the vaccines affect human DNA.
Yeah, yep, exactly.
And is it correct that you said you can have the Janssen vaccine 28 days after you've had a Pfizer vaccine?
Yes, if you had a lot of reaction for the first dose to either the Pfizer or the Moderna vaccines, you can wait 28 days and get the Johnson & Johnson vaccine instead of the second dose of the Pfizer or Moderna.
That's all the questions in the chat box so far.
There is a question about whether Johnson & Johnson will be available on a larger scale, but it sounds like we have really no way to tell right now. It's coming on a limited scale. It's not predictable.
Yeah.
So more to come. As we can see, this is a continuous learning process as we face this. You know, we've entered a combat zone with a viral enemy who keeps evolving, and we keep learning. We keep getting new tools. Treatment has improved. Some groups have improved their behavior to not spread, and the vaccines have proliferated, and I know there's other things coming. Like I know that FEMA has an RFP out to recruit massive numbers of vaccinators, so that as the vaccines become more available, and you can hear that County Public Health is working with others to build out more and more sites, and even how to get to the home. And as we do that, then we need more people to deliver the supply of vaccines that come. And my understanding is that probably sometime in April, that is likely to come, because to get to the ambitious goal by end of May that President Biden predicted yesterday, a great goal, we will need to do that. People will have to say yes, and someone will have to be available to do, and the supplies and all the materials need to be there. Do I see another chat question, Karen? Looked like maybe there was activity in the chat box.
There's one more in the Q&A section. It says, my son is allergic to Bactrim. Should we be concerned for an allergic reaction for any of the COVID-19 vaccines?
So I would definitely speak with your son's PCP, but Bactrim is an oral medication, or I mean, it usually is given as an oral medication. So for oral medications, even for the Moderna and Pfizer vaccines, it's not depending on the reaction, it's likely not a precaution. It's likely not a contraindication or even a precaution. So it would depend on the, at the most, if it's Bactrim or another oral medication, it just might be some precautions if it was an actual severe allergic reaction. And then I also wanted to say for that, the guidance in terms of getting the Johnson & Johnson vaccine 28 days after one of the mRNA vaccines is, I did just check, and the CDC did finally release their official guidance on the Johnson & Johnson vaccine. So it's the same guidance as, with interchanging or mixing Moderna versus Pfizer, which is only if it's under exceptional circumstances. So I guess that would mean, like, if you had a severe allergic reaction with either Moderna and Pfizer, you spoke to your doctor about it and they feel like it would not be safe for you to get the second dose, and so then Johnson & Johnson could be considered. But that would, again, be a discussion with your primary care physician.
What will be done for small communities? Some people are waiting for their doctors to get the vaccine due to distance.
What will be done for small communities?
I guess they mean out of Los Angeles.
Well, we have small communities out in the desert, and within the county there are some.
Oh, you mean like in Antelope Valley?
Sure, there are some outside of Antelope Valley. There are rural areas in LA County, of course, even in the mountains and so on.
Oh, I see what they're saying. Yeah. Yeah, so the part of our outreach for the senior housing and senior centers some of them do include those areas. I think that the other options would be
pharmacies.
Yes,
pharmacies in the bigger areas. Like I'm actually from Lancaster, and places like Little Rock and like Juniper Hills, Pinon Hills, and then the other way on the 138, like Antelope Acres and such. Unfortunately, they would need to come and find pharmacies in Lancaster or Palmdale that they could be vaccinated at.
Yeah.
I think your FQHC in Antelope Valley now is also getting some supply. I did see that there's some solutions now in Antelope Valley. So we see growing capability to widely disperse these resources as time is passing, and we thank County Public Health for really helping lead that along with city government and county government. These are, we see a debate about the role of government across our nation, but I applaud you. I know that you're a government, and we all rely on you for these safety measures. So it's great to see growing successes, growing capacity, growing innovations, and how to really get to supply and get supply to those in need, and especially to address the disparities, which are so deep and so important. These are life-threatening illnesses, so it is so crucial to make sure that those most at risk have access right away.
I believe in Lancaster, the Kaiser is going to be setting up the vaccine distribution in the AV Fairgrounds as well. That's coming down the pike.
Is it still recommended if you've had COVID to wait 90 days to get the vaccine?
So that recommendation is made based on the assumption that there's a limited supply of vaccine, which overall as a county we do. But let's say that, if you're getting your vaccine at your local pharmacy and they have sufficient supply to vaccinate you, then it's not a contraindication or even a precaution. It's more just sort of like for equitable distribution guidance. So, and that's made because, within 90 days, it's thought that you have enough immune protection, that you're very unlikely to get reinfected during those 90 days. And so if there's a limited supply, it's better that somebody else who's never gotten COVID to get that vaccine first. But you yourself, there's not like a medical contraindication to getting it earlier.
If someone has a nut allergy, is there one vaccine that's better than another for them to be taking?
I don't think so. I think with the allergy question, I don't think there's one vaccine that's better than the other. I think that the tolerability that they looked at was more the systemic, like the post-vaccination symptoms that you would get to and it's a natural part of the vaccine, kicking up your immune system and building those antibodies, like having muscle aches and just feeling very tired, maybe headaches, low-grade fever. I think those tolerability types of side effects was seen less in Johnson & Johnson, but I'm not sure about the allergies, if there's one that's better than the other.
If you've just taken the second dose of your shingles vaccine, what's the safe amount of time to wait before you get the COVID vaccine?
Yeah, that's a great question. That would be 14 days. So,
no, not long. That's good.
Yeah, 14 days. If you just got your COVID, same thing. If you just got your COVID vaccine and you're due for another vaccine, you should also wait 14 days after as well.
These are all good questions. Are there some additional questions or comments from the audience that you'd like to share, either through the Q&A box or people are also using the chat box? We're open to either. Otherwise, it would be my pleasure to say how much we appreciate this medical leadership. This is a newer unit in County Public Health as they've rallied. They are a first form of defense for all of us, leading us through this pandemic. So we're quite appreciative of you all stepping up to attend our first presentation like this, that we feel is an extension of our work to empower all of us to have best health possible in order to have best quality of life possible. We are seeing other results from this pandemic and the related shutdown and isolation that's coming. So some of our work has moved out into new arenas. We have discovered that the digital divide is actually a utility that must be overcome. We saw some of that in this presentation about the challenges in getting appointments, the kind of access that creates. And in addition, we have been seeing dramatic issues of social isolation and loneliness, which are powerful drivers of health and life expectancy. And so these arenas, we have strong and wonderful leaders in our community that we partner with closely and learn from about these. We're working in these areas. And so our next virtual event like this, as I say, this is new for us, is Thursday, March 25th. We would welcome you to join us and also to spread the word in case these issues are of relevance to others. We have a good capacity. People need to register ahead, but we can expand the Zoom ability as needed. If all of you know these people as well as I do, you'll be in their fan club like I am. Dr. Scott Kaiser, who's the Chief Innovation Officer, Motion Picture and Television Fund, and our dear Laura Trejo, who is the General Manager of the City of Los Angeles Department of Aging, and a wonderful leader. They will be our presenters on these topics, and they are emerging, and there's a lot of work coming out now, which we hope some of you can join in to overcome the digital divide and in other methods to attempt to reach out and address the powerful, painful realities of social isolation and loneliness. So as we all continue to innovate, to experiment, to try to really rise to the occasion this pandemic has brought, we all learn together, we all collaborate together. So we're most appreciative that you took the time to join us today. Dr. Nie and Dr. Das, we are very grateful for your leadership and for your presentation today. Your expertise, it's great. And please join us next time, and thank you so much for joining us today. Please follow up with us if you have other issues at Partners in Care Foundation.
Thank you.
There you are, Victoria Loy. We'll be happy to have you send questions to her email, and we will respond happily to you as we all join forces to rise and make LA safe, happy, and healthy. Take care.